Hello, my name is Joshua Brown from the expert interview training company howtobecome.com, and in this presentation I'm going to give you my top scoring answers to NHS behavioural interview questions based on the NHS values. So if you have an NHS job interview coming up for any role with any NHS trust, then please make sure you watch this video from start to finish, because I promise to help you to stand out and succeed. To achieve that goal, this is what I'll cover. I will tell you which NHS values and the interview questions you must prepare for. I'll then give you my top scoring answers to each NHS interview question to help you to pass at the first attempt. And then at the end, I will also tell you where you can instantly download these slides and my full guide that contains my 50 quick answers to NHS interview questions. This is a brilliant resource that's helping lots of people to pass. And just very quickly, please tell me the name of the job role that you're applying for in the comment section below the video, and I will give you some additional tips and resources to help you to prepare. Thank you very much. Oh, and please don't forget to subscribe to my channel, because I want to help you to pass your interview by giving you brilliant answers to the toughest NHS interview questions, and I can only do that if you are subscribed. And please also don't forget to hit that like button, because this really does tell me you find these tutorials useful and encourages me to make more content for you. Okay, I want to focus on the NHS value of compassion, and I'm going to go through at the end of this video all 6 of the NHS values, what they mean and why they're so important to your success at interview. But let's start off with this question here, which is based on the value of compassion. Describe a time when you demonstrated compassion in your work. Now, this question evaluates your ability to provide care that is empathetic and considerate towards patients' feelings, emphasising the NHS core value of responding with humanity and kindness. So make sure your answer focuses on specific examples or where you've gone above and beyond to address a patient's emotional and physical needs. My advice is to highlight how your actions improve the patient's experience and outcome, and it should always be positive, of course. And just before I give you my brilliant top scoring scripted answer to this interview question, here is a bonus tip for you. It's really important to understand the #1 strategy for answering behavioural interview questions like this one, and that is to use the STAR structure, STARR. The STAR method is a brilliant way to structure your answer to any behavioural interview question. So S stands for situation. You start off with a situation. What was the situation you found yourself in? You then move on to T for task. What was the task that needed to be carried out? A is for action. What action did you take to achieve the task? R is for result. What was the end result for your actions? It should always be a positive end result. And the final R is reflection. What did you learn from the experience? This is a really brilliant way to structure your answers that's going to make you a top scoring candidate at interview. So let's look at that question again. Describe a time when you demonstrated compassion in your work. Here is my top scoring answer. During my previous nursing role, I was assigned to care for an elderly patient who had been admitted with multiple health issues and was showing signs of severe anxiety due to the unfamiliar hospital environment. My main task was not only to manage her medical treatment, but also to ensure she felt safe, understood and cared for during her stay, which was crucial for her emotional well-being. I spent extra time with her each day beyond my usual duties. I listened to her concerns, explained all procedures in a gentle and reassuring manner, and brought in a few items from her home with the permission of her family to make her feel more comfortable. Additionally, I coordinated with the healthcare team to adjust her treatment times so she could have her son visit during hours that worked best for them. My efforts resulted in a noticeable improvement in her mood and anxiety levels. She became more cooperative with the treatment and expressed profound gratitude for the personalised care. Her son personally thanked me, mentioning how the compassionate care had not only eased his mother's distress, but had also given him peace of mind. This experience reinforced my belief in the profound impact of compassion in healthcare. It taught me that treating patients with empathy and consideration can significantly enhance their recovery experience. It has encouraged me to continue finding ways to integrate compassion into daily care, recognising that sometimes these non-medical contributions are as crucial as the treatments we administer. Now that is a top scoring answer that demonstrates compassion in action. the positive impact on the patient, and personal growth, aligning well with the values expected in the NHS. Let's take a look at respect and dignity. This is a really tricky value sometimes to get right, as many people overthink it when they get asked questions such as this one. Tell us about a difficult interaction you had with a patient or a colleague and how you resolved it. Now, this question looks at how you respect and value every individual, managing conflicts or managing interactions with professionalism. So my advice here is to describe a situation where you used effective communication and empathy to resolve a conflict. Emphasize how you respected the other person's perspective and work towards a mutually beneficial outcome. So let's take a look at my top scoring answer. At my previous nursing position, I was assigned to work with a patient who was notoriously difficult and resistant to medical procedures due to a fear of hospitals. This patient had previously had negative experiences that exasperated their anxiety and mistrust towards healthcare staff. My task was to administer necessary daily treatments while also building trust and ensuring the patient felt comfortable and understood during their stay. I approached the situation with empathy and patience, dedicating extra time to listen and respond to the patient's concerns. I involved them in all decisions about their care, explaining each procedure in detail and discussing alternatives when possible. To build rapport, I shared stories from my own experiences where relevant, showing vulnerability and humanity. I also arranged for consultations with a therapist to address the patient's anxiety more comprehensively. Over several days, the patient's attitude began to change. They became more cooperative and expressed appreciation for the efforts to accommodate their fears. By the end of their stay, they were much more relaxed with the hospital staff and even agreed to follow up treatments that they had previously refused. This experience underscored the importance of empathy and communication in healthcare. It taught me that taking the time to understand and address a patient's fears can significantly impact their treatment experience and outcomes. I learned valuable lessons in patience and the impact of compassionate care, which have since guided my approach to all patient interactions. That was a great answer that will really impress the hiring manager. This response not only highlights your ability to handle challenging interactions, but also demonstrates your commitment to patient-centered care, a key value in healthcare environments like the NHS. It shows your capability to effectively use soft skills, such as empathy and communication, which are crucial in managing difficult interactions. Now, don't go anywhere, as I still have plenty more interview questions and answers on the NHS values in this video tutorial to give you. But when you're ready, and only if you want to, you can click that link in the top right hand corner or in the pinned comment below. It will take you through to my website, howtobecome.com, where you can download my 50 quick answers to NHS interview questions. It's suitable for all job roles and it's guaranteed to give you the edge in your interview. Okay, let's take a look at the next NHS value, which is working together for patients. Now, the question here is, describe a time when you had to lead a team through a challenging situation. Now, this question assesses your ability to lead and work collaboratively with a focus on patient-centered outcomes. Now, many NHS roles, depending on which band you're applying for, will require you to utilise and display leadership skills. So for this question, make sure you share an example of where you led by example and coordinated team efforts to overcome a challenge. You can highlight how you ensured that patient care remained top priority throughout that situation. That would be a great thing to do. So let's take a look at my top scoring answer. During my tenure as a healthcare assistant at a nursing home, we faced a severe influenza outbreak. This outbreak coincided with staffing shortages due to illness, significantly increasing the workload on the remaining staff. As one of the more experienced healthcare assistants, my task was to coordinate our limited resources effectively to ensure continuous patient care, while also implementing increased infection control measures to prevent further spread of the virus. I organised a strategy meeting with the available staff to plan our approach. Recognising the need for strict infection control, I delegated specific responsibilities such as administrating medication, monitoring patient symptoms, and disinfecting communal areas. I also initiated a temporary shift rotation to maximise coverage during peak times. To maintain morale and efficiency, I held brief daily briefings to update the team on patient statuses, healthcare safety protocols, and to provide emotional support. Our proactive measures helped to control the outbreak effectively within 2 weeks. The staff managed to maintain a high standard of patient care under challenging conditions, and the spread of influenza was significantly mitigated. Our team's efforts were recognised by the nursing home management, who commended our dedication and teamwork in a subsequent staff meeting. This experience taught me the importance of leadership in crisis situations and the effectiveness of a well-coordinated team effort. I learned that clear communication, adaptability, and supportive leadership are crucial in managing a healthcare team under pressure. This incident has further motivated me to pursue additional training in healthcare management to better prepare for future challenges. I love this example, as it shows how a healthcare assistant can take on leadership roles in a critical situation, emphasising skills in team coordination, communication, and crisis management, which are all invaluable in a healthcare setting. Okay, the next NHS value I want to focus on is commitment to quality of care. The question here is this: can you provide an example of how you handled a high-pressure situation? Now, this question assesses your dedication to maintaining high standards of care under pressure, ensuring safety, effectiveness, and a positive patient experience. My advice is to discuss a scenario where you maintained your professionalism and quality of care despite challenging circumstances. Demonstrate your problem-solving skills and ability to stay calm and focused in your answer. Okay, here is my top scoring answer to help you. At my previous job in a large retail pharmacy, we faced a critical day when our computer system malfunctioned during a peak hour. This incident coincided with a flu vaccine drive, resulting in an unusually high volume of customers and prescriptions. My task was to manage the pharmacy operations efficiently despite the technical failures, ensuring that all customers received their medications and vaccinations on time and safely. I quickly established a manual tracking system for prescriptions and vaccinations to ensure accuracy and continuity of service. I delegated specific roles to team members to handle manual entries, customer service, and crowd management. I also communicated openly with customers about the situation, explaining the delay and ensuring them that we were doing everything possible to minimize their wait times. Despite the system outage, our team successfully processed all prescriptions and vaccinations for the day without any errors. Customer feedback highlighted appreciation for our transparency and efficient handling of the situation. This experience taught me the importance of staying calm under pressure and the effectiveness of clear communication during a crisis. It also reinforced my ability to quickly adapt to unexpected situations and lead a team through challenging circumstances. I learned that proactive management and flexibility in problem solving are essential skills in high pressure environments. Now, this response highlights your leadership and problem solving skills, your ability to communicate effectively under stress, and your commitment to service quality, all of which are valuable traits in any high-pressure job, particularly in healthcare settings like the NHS. Okay, the next NHS value is improving lives. So here is the question. Discuss a situation where you took initiative to improve patient care. Now, this question tests your proactive approach to enhancing health and well-being, showing your initiative to make positive changes. My advice here is to provide an example where you identified an opportunity for improvement and took steps to implement a change. Focus on how your initiative led to better outcomes for the patient. So here is my top scoring answer to help you. In my previous role as a nurse at a rehabilitation centre, I noticed that the discharge process was causing confusion among patients due to inconsistent information being provided about post-discharge care. My task was to improve the discharge process to ensure that patients left the facility with a clear understanding of their post-discharge instructions, which was crucial for their health and recovery. I took the initiative to create a standardized discharge checklist that included all necessary information, such as medication schedules, follow-up appointments, and signs of potential complications. I collaborated with doctors, nurses, and administrative staff to gather input and ensure that the checklist was comprehensive and easy to understand. I also arranged training sessions for the staff to familiarise them with the new process. The implementation of the discharge checklist led to a significant reduction in patient confusion and a decrease in readmission rates. Feedback from patients was overwhelmingly positive, as they felt more prepared to manage their healthcare post-discharge. The staff also appreciated the streamlined process, which saved them time and reduced errors. This experience taught me the importance of proactive problem solving and the impact of small changes on overall patient care quality. It reinforced my belief in the value of clear communication and thorough preparation in healthcare settings. I learned that by taking initiative and leading change, I could directly contribute to better patient outcomes and more efficient healthcare delivery. This is a great answer that effectively demonstrates your ability to identify problems, take initiative, and implement practical solutions that enhance patient care and safety. It also shows your leadership potential and your commitment to continuous improvement in a healthcare setting. Now, in preparation for your NHS interview, it is important to understand and prepare for questions on all NHS core values, all 6 of them. The NHS values underpin the reasons why they are one of the best and most respected healthcare providers to work for in the world. You must be able to demonstrate these in your NHS interview. So let's take a quick look at what they all are before I then provide you with the resource to get all of the questions and the top scoring answers. So the first NHS core value is working together for patients. So at the heart of the NHS is a fundamental commitment to prioritise patients. Whether you're applying for a role as a nurse, consultant, or support staff, demonstrating how you place patients first in every action and decision is crucial. Respect and dignity is the next core value. The NHS values each individual, their patients, the families, carers, and staff. So when applying, make sure you show your ability to respect and appreciate individual differences, aspirations, and needs. You could discuss how you ensure everyone feels valued and supported in your interview answers, for example. Commitment to quality of care is the next NHS value. So quality of care is a cornerstone of the NHS. You must showcase your dedication to maintaining high standards in safety, effectiveness, and patient experience. My advice would be to provide examples from past roles where you insisted on and contributed to high quality outcomes. Compassion is a really important NHS value. So compassion is central to the care provided by the NHS. Your interview answers should reflect your capacity for empathy and kindness, especially in responding to pain, distress, or anxiety. So make sure you illustrate this through specific instances where you've demonstrated compassionate care. That's really important. The next NHS core value is improving lives. So the NHS strives to enhance health and well-being. So make sure you highlight your commitment to this goal in your interview answers by sharing examples of how your work has positively impacted individuals or communities and how you plan to continue making such improvements within the NHS. Everyone counts. This is a really important NHS value. Inclusivity and fairness are key in the NHS. It's important to convey how you ensure equitable care and services, utilising resources efficiently to benefit the whole community without discrimination. So make sure in your interview answers you discuss how you have or how you will work to include and support every individual, leaving no one behind. So the next thing to do, if you would like to download example answers to all of the toughest NHS interview questions, is to please make sure you click that button in the top right hand corner of this video right now, or in the pinned comment below the video. Head through to my website, howtobecome.com, where you can download these slides and get access to 50 NHS interview questions and high scoring answers to each question in a PDF guide. This guide covers all 6 of the NHS values. It's the ultimate guide to prepare you for your upcoming interview. You can literally have access and the slides in your inbox within 2 minutes from now, and it's guaranteed to help you prepare effectively for your interview and also, more importantly, put you ahead of the competition. Make sure you check out that link. I hope you've enjoyed this tutorial. Please don't forget to subscribe, as I'm on a mission to help as many people as possible pass their job interviews, and I can only do that if you are subscribed. Please also hit that like button, as that really does encourage me to make more videos just like this one. And if you have any questions regarding any specific job role, do let me know in the comment section below which job role you're applying for and which NHS trust, and I will get back to you with even more interview tips and advice. I literally respond to every single person who leaves a comment on my channel, so do reach out to me there. And finally, don't forget to connect with me on LinkedIn. I've put my LinkedIn link in the description below. It's always great to connect with like-minded professionals such as yourself. Thank you so much for watching. I wish you all the best with your interview. Have a brilliant day.